Hi everyone, let's take a quick look at the steps of the secondary assessment. And these are going to consist of 1, getting a set of vital signs if you've not gotten them already. And in most EMS algorithms, the secondary assessment starts with the vital signs. No reason to change that. Next, we're going to look at their sample history and the H's and T's. Looking at the sample history, S, signs and symptoms. Remember, a sign is anything you can measure, a respiratory rate, a blood pressure, an objective finding. A symptom is something the patient tells you. I'm short of breath, I got chest pain, subjective. Next, allergies. And this should include all allergies, not only medications, but food and environmental allergies. M, what medications is the patient taking? And this should include, again, not only prescribed medications, but over-the-counter and herbal supplements should be included there too. P, their past medical history. This is huge. We need to know any contributing factors. Does the patient have a history of heart disease, asthma, diabetes? Review their past medical history. L stands for the last oral intake. Particularly helpful to know in your diabetic patient that may have taken his insulin but didn't eat anything because he was in a hurry to get out the door that morning. It happens. So when was the last time the patient had anything to eat? May also be important if the patient's going to the surgery because anesthesia wants an empty stomach. Can't blame them. Finally, the sample ends with E, which stands for the events surrounding this. What was the patient doing when this came on? Were they working hard? Were they sleeping? What was the patient doing when their symptoms started to present? After you've finished your sample history, take a quick review, but a thorough review of the H's and T's. And remember, the H's and T's is kind of our hit list. It's our list of usual suspects or the causes for our patient's condition. Why they deteriorated or why they collapsed in the first place may be attributed to one of the H's and T's, and we're looking for reversible causes. That's what the H's and T's are for. Our usual suspect is it a reversible cause that I can treat my patient with. Okay, this has been a quick review of the steps of the secondary assessment. I'm Mark, thanks for watching. See you in the next video.